I wanted to share with everyone today an option because everyone's asking about how do you actually access an appointment in midlife for menopause. Can you talk a little bit about your new menopause, perimenopause offering and however you want to introduce yourself in One Medical?
I'm medical director for women's health and menopause care at One Medical. We started with a pilot. We had 1,000 patients, and patients told us, we really appreciate this. A lot of folks were feeling a lot better. A lot of people got on hormone therapy, some on non-hormone therapy. We created an intake survey that we're really proud of to help people come in ready for their visit.
Because that's the thing about like perimenopause and menopause care is part of making it great is the process and the data. So if you could just speak to that.
Yeah, I agree. We are collecting data in a lot of different ways, and one of them is through the survey. The survey's greatest importance is to clinical care at the moment, though. So it's having our patients and providers be a little more primed and ready to have a great discussion. Sometimes when we come into the visit, I can say as a patient myself, I can forget some of my most important questions that I have or concerns. So we're finding that this survey is inviting people to talk about a lot of these things that maybe they hadn't realized were connected.
When you're there, it's like, of course, 5 things came up beforehand and you forget your blood pressure's up. It's the hospital lighting. Have you found that when a patient actually shows up, does that intake form actually help the system to get ready for what that visit might look like?
Yeah, it helps a lot because not only do we ask, are you experiencing this, but we also say, how much is it bothering you? And that can already help because then when my patient comes in, if I haven't met her before, I can say, hey, you mentioned that you are newly having these really severe headaches. Is that the thing that's most important, or what's coming to the surface for you? Because if we could fix one thing, what would really make the biggest difference for you? And so it helps to prompt those conversations. It also helps me as a provider to start thinking, okay, they mentioned heavy vaginal bleeding and cramping and headaches. I'm already starting to think about which combinations of treatments might be more useful for this person, because especially in perimenopause, there are a lot of different treatment choices, and what works for, someone's friend or mom or sister may not be what's right for them.